Hi everyone, it's Keisha. I am presenting my experiential activity on emotional freedom technique, otherwise known as tapping. The background information on emotional freedom technique, it originated from the ancient medicine principles drawn from the traditional Chinese medicine of acupuncture. Uh, Acupuncture has been around for thousands of years. Developer of this particular emotional freedom technique resulted out of um, emotional transformation therapy, which was developed by Roger Callahan, which was a clinical psychologist. Gary Craig then was a student of Callahan, and he wanted to develop a self-help intervention that would allow those that were suffering from anxiety, depression, or any other health illnesses to have relief from those things that they were suffering from without actually having to seek Western medicine. So Gary Craig introduced emotional freedom technique in 1995. It is a shorter version of emotional transformation therapy that was created by Roger Callahan. So afterwards, Mary looked into the intervention to see if by possibility that this intervention would be effective for food cravings and weight loss as well. The philosophy and theory behind weight loss. The philosophy and theory behind emotional freedom technique. Basically, the premise is emotions and thoughts are forms of energy, and whether those thoughts are negative or positive, they still are forms of energy and they affect the body in some form or fashion. The theoretical foundation of the practice is basically the tapping process is done in order to reduce physical tension in the body, and it promotes a deeper mind-body connection. So the research, evidence-based research does support and shows an effectiveness of emotional freedom technique on weight loss. There were two random control trial studies done and one study. The random control trial study done by Stapleton used 83 obese or overweight adults, and it was basically a comparison study, and they wanted to see if emotional freedom technique and cognitive behavior therapy yielded different outcomes, but when it came to the food cravings of these individuals. However, it showed that both therapies were equally effective for food cravings, decreasing food cravings. The next study looked at online Naturally Thin You program, and it had 76 individuals, which they divided those individuals into 6 groups for 6 weeks, and they focused on the cravings and also emotional triggers for those cravings, and basically trying to find out if it was effective for these cravings. And yes, the results showed that emotional freedom technique did influence the choices of food of these individuals, their cravings, and also with weight loss. The random control trial study, which was done as a post study 2 years after these individuals had taken an 8-week online self-directed EFT intervention course dealing with cravings, dealing with dietary restrictions, and dealing with having power over food. They reached out to these individuals, and these individuals basically explained to them that they continue to show improvements in these areas. So EFT is effective for weight loss. So how does EFT tapping work? Basically, you'll have a thought, a negative thought that comes to mind. It releases the fight or flight response in the body. As soon as you start tapping the affirmations, immediately it distributes a kinetic energy in the body that automatically shuts down that negative thought or emotion, and it allows the positive energy to flow, and it creates a flow of harmony and balance in the body. And also the emotions are linked to emotional freedom tappings in the body, which you can't see, but I have a chart here and it shows you exactly how these tappings are related in your body. So if you tap on your eye here, that meridian is connected to your stomach meridian, which if you have a stomach ache, you can tap on your eye and it may relieve you of that stomach ache. So when should you tap? You should tap at any point that your emotions are getting out of control. You feel that you're triggering, you may be triggered. You have a desire to eat junk, sweets, pop, anything that you shouldn't eat. It's a good indication that you probably should tap. If you cannot answer no to this question, most likely we need to tap. So we'll start tapping now. At the beginning of each session, what you want to do is you want to assess your level of craving on a scale of 0 to 10, 10 being the most. Where's your craving at right now? You want to take a deep breath and you want to relax. We're going to start here. We're going to use our fingertips and we're going to hit the side of this fleshy part of your hand, and we're going to seal in our statement of what we're tapping on. Basically, it's just a vent and a rant of how you feel about your negative emotions and why you can't have what you want to have. So it's called the karate chop. Even though I do not feel I am in control of my eating right now because I want a piece of chocolate cake, I truly love and respect my body. Even though I do not feel I am in control of my eating right now because I want a piece of chocolate cake, I truly love and respect my body. You're going to do that 3 times. Then you're going to start here at the eyebrow, and you're going to start tapping on your on the feelings that you have, the feeling of failure, the side of the eye, the feeling of shame, under the eye, this feeling of guilt, under the nose, the inability to challenge my emotions, under your chin, this feeling of less than, the collarbone. I am loved because of John 3:16. Under your arm, I am lovable. It's okay to be loved. The top of the head, today I choose to forgive myself. The crown basically is going to send that message throughout the meridians in your body. So afterwards, you're going to take a deep breath. You're going to reassess your craving level. If it's still high, it's okay. You're going to go back in and do another round of tapping. You want to continue to do tapping rounds until that craving subsides to a tolerable level that you are in control, or it's at a 0. So the contraindications, if you have limited upper mobility, dehydration, impaired breathing, or emotional triggered health illnesses, the modifications are you can do a verbal or mental tapping. You can do this intervention with your eyes open or closed. You consider stand. You want to make sure you hydrate yourself before performing this intervention. And the affirmations can be substituted for religious purposes, biblical scriptures, prayers, or daily devotions. So what interests me is emotional freedom technique. The reason for my selection of emotional freedom technique is my focus on my dissertation work. I want to understand the factors that contribute to the increasing obesity rates in African American women, and I want to find an intervention that would incorporate the mind, body, and spirit needs of the individual. And I feel that EFT self-help intervention would be applicable to my population of interest because there are no certifications. The intervention can be used with or without a therapist. It can be used as often as needed. It can be performed in public or in private. And most of all, it is a cost-effective intervention. Thank you.